Okay, female and male pattern hair loss. Remember that in females, the androgen levels in most women are normal. In contrast to a woman with PCOS, they will have hyperandrogenic state. In men, the hair loss is actually driven by androgens, so primarily DHEA, like in androgenic alopecia. In female pattern hair loss, you will see thinning in the crown and the midline of your patient, whereas men will normally have a receding hairline in androgenic alopecia. Generally, in women, the hairline is preserved. The first-line treatment for women in female pattern hair loss is topical minoxidil. This vasodilates the scalp and increases blood flow to it. It can cause local irritation and itching. Very rarely, but it can happen because they have so much vasodilation, the patient can feel lightheaded and also can have reflex tachycardia. In men, they also have balding in the vertex, temporal areas, and the frontal hairline, but you treat them with minoxidil or finasteride. As of now, finasteride isn't very well studied in women. Now, if you're suspecting that your patient has a dermatophyte infection, such as if there's a picture that shows a round pruritic scaly plaque, or they have post-auricular lymphadenopathy, definitely start thinking about Tinea capitis, and you would treat this with terbinafine. Now, if the patient has diffuse hair loss, it's not just in the crown or very specific areas, then think about telogen effluvium. This is in response to a physiological stressor, such as if the patient was pregnant. For these patients, just give them reassurance. Now, if the patient has a very round area of no scars and just complete hair loss, you should be thinking about alopecia areata. I remember this as an area of the patient's head has round patches with no scarring. Alopecia areata. You treat this with intralesional corticosteroids, and you can even use some topical agents. Lastly, if you have a PCOS patient with hair loss, aggressive weight loss programs are very important for them, and they won't just present with hair loss, they will even show signs of hirsutism.